So in this video, I am going to discuss about another famous Nclex medication known as Furosemide, also known as lasix, right? So during your Nclex exam, there are high chances that you're going to see a lot of question on Furosemide. Very famous medication, you must know, right? So at the end of the video, we're gonna do around 18 to 20 practice question, and you will see how easy it is going for you to solve all of your question answer immediately, right? So you don't have to think twice, it's going to be super fast. So let's start. So what is lasix? So it's a loop diuretic medication, right? And also known as a water pill, correct? So what is the function of this medication? So this medication, I will try to explain you in simple words how this medication work, right? So what's the function of this medication? So this medication is given to the patient with heart failure or who has a kidney problem, right? So this medication is given to the patient with a heart failure or who have hypertension or has any kidney problem. So these three are the main categories: hypertension, heart failure, and any kidney disease or kidney problem, right? So this medication is given to those patient. So how this medication is going to work? So once you take furosemide lasix, another name is lasix, right? So it will tell your kidneys to remove excessive amount of fluid in your body. So it will again tell your kidneys to dump all your excessive amount of fluid that is holding in your body. That's how this medication is going to work, right? It will tell your kidneys to dump all the excessive amount of fluid in your body, right? So when this happen, what's going to happen? So you will pee a lot, right? So when you are peeing a lot, what's going to happen? So you're gonna lose, same time you're gonna lose a lot of salt, you're gonna lose a lot of electrolytes while peeing, right? And very important thing that you're going to lose is a lot of electrolytes, but the main one you need to know for this medication is potassium. That is the main one, because if you're gonna lose too much potassium in your urine, what's gonna happen? If you are running low potassium, it's gonna disturb your heart rhythm, right? It's gonna disturb, create problem for the heart, right? So that is very important thing. Let me tell you the easy way how you're gonna remember. So let's say this is moon, right? So all your international space shape is revolving around the moon, right? It's like that, circling, right? So also in lasix, I'm gonna give you three categories, and all of your answer is revolving around these three topics. You will see how easy it is going for you to solve all your problem. So let's say moon number one. So moon number one, we're gonna say blood pressure. So when you see all of your question is gonna revolving all around blood pressure. That's your moon number one, right? Blood pressure. Second thing is, second moon is electrolyte. All your question about furosemide is revolving around uh, furosemide. All your question is gonna running circling around electrolytes, right? And the third thing is all your question is revolving around kidney problem. Kidney problem, right? So three moons, right? Three categories: first category, second category, and third category, correct? So bear with me. So let's start. So this medication, let me tell you what you have to do first. So during your exam, you will see a question, what is the best time to give this medication, right? So the best time to give this medication is in the morning time. Why you have to give in the morning? Because this medication will drop the blood pressure, right? And same time, the patient will urinate a lot. So if you give this medication in the evening time or night time, there are highly chances that the patient gonna go bathroom again and again, because after you take this medication, the patient gonna go bathroom multiple times. So if the patient keep going bathroom in the, just imagine patient going in the evening or night time again and again, right? There are high chances that patient gonna have fall. So that's why this medication is given in the morning. So by the evening time, the medication effect is over, so patient can sleep comfortably, right? So that's the reason you're gonna give this medication in the morning time. Now the first moon, which is blood pressure. So this medication also removing the excessive amount of fluid in your body, but same time it's also dropping your blood pressure. This medication is also given to the patient with hypertension. So this medication will also drop the blood pressure. Very important thing, right? So when somebody blood pressure is dropped, like let's say this is moon, right? Blood pressure category. So when somebody blood pressure is dropped, usually the doctor says hold this medication if the systolic blood pressure is less than 100, right? So you're gonna hold this medication based on the doctor order. But mostly I have seen this hold this medication if blood pressure is less than 100. Also when you're giving this medication, the blood pressure will drop, right? So what are you going to do? Tell the patient. So you will tell the patient when you have to get up, you have to get up slowly to prevent syncope or prevent fall, right? Very important thing. So this medication will drop the blood pressure, and same time you have to tell the patient when you have to get up, you have to get up slowly, right? Slowly, because this medication will cause drop in blood pressure. So patient may feel syncope or patient may feel dizziness. So that's why in order to prevent the fall, you have to tell the patient to get up slowly, right? That's the important thing. Also this medication cause orthostatic hypotension, correct? Right. Next thing, second thing about second moon, right, which is electrolyte. So as I mentioned, this medication will help you to lose a lot of fluid from your body, right? So very important thing with the fluids, you will lose electrolytes. Very important thing is sodium, potassium and magnesium. But very important for this medication for Nclex, they are looking for potassium. This medication will because this medication absorb through kidney, right? So kidney will excrete most of your medication. So patient will lose a lot of potassium. So when potassium level is dropped, what can happen? So the patient will feel muscle weakness, because that's the side effect of low potassium, right? So patient will feel muscle cramps or muscle weakness. So very importantly, you have to check for, what do you have to check for? You have to check for potassium labs, right? You have make sure the potassium is in range. If the potassium is running low, hold this medication. Important thing, right? Remember that low potassium level, what do you call? You call hypokalemia, right? Correct. So you must know this medication cause hypokalemia. So when somebody gets hypokalemia, what do you have to do then? If somebody is losing potassium, then you tell the patient, hey, eat potassium rich food. So what are you gonna offer them? Now during your exam, they're gonna give you a lot of food category, which food you're gonna give, right? So what are you gonna give? So as you know, potassium found in where? Oranges, very important, banana, spinach, dry nuts, right? Banana, right? Spinach, dry nuts, orange, potatoes. Those are the main 5 food for you for potassium rich food. So that's what you're gonna offer to the patient, right? And the last thing is the third moon is kidney. So you're gonna check kidney function, because this medication excrete through kidneys, right? So imagine if your kidney is already damaged and you are giving furosemide, so there are chances it will damage more. So that's why you time to time you have to check for kidney function, right? Kidney function like creatinine, you're gonna check their creatinine level to see if the medication if the patient required less dose of furosemide or more dose based on the numbers, right? So very important. Also, you going to check patient intake and output, in mostly output, right? So you're gonna check how much they are wasting in a day, right? Important thing. So with that much of information, I think we are ready to solve our practice question. So let's solve practice question, and you will see. Hopefully you will be because there are 20 at least 15 to 18 practice questions. So we're gonna go super fast. But when you're watching this video, you're always welcome to pause the video and give answer and move on that way. So you will know that you're giving answer correctly, right? But I'm gonna go a little bit faster because the video time is gonna be longer if I go slowly. So let's do it. Right. Okay, let's begin. So just wanna mention you one more thing, that these questions are available online for free practice. Nothing belongs to me. I'm just using this question just for learning purpose, right? So whoever created this question, credits to them, totally credit to them. Just I'm just using for learning purpose, right? So we're gonna do 16 or 17 practice question fast. So let's begin. A patient receive IV furosemide is now reporting leg cramp, right? Which action should the nurse take? So when somebody is reporting leg cramp, that's when we are suspecting low potassium level, right? So what we're gonna do if we are suspecting low potassium, we're gonna check the potassium level. So answer C is your final answer, because before you intervene, you have to assess first. Always remember that. So before intervene, assess first. So assess means check the patient potassium level to see where are the numbers. Next question, a nurse is caring for a patient taking furosemide. Which finding should the nurse report immediately? So as I mentioned, this medication caused a drop in potassium level, right? So patient is complaining muscle weakness and irregular pulse. So when this happened, the nurse should report immediately. Maybe the patient potassium level is running low, right? So answer B is your final answer. See, all the question is around the topic that we discussed, right? So once you know this category, blood pressure, electrolytes, and kidney function, all your answer is going to be somewhere around there. Third question, a patient with heart failure is prescribed lasix. Which electrolyte imbalance is the most concern about? So what we concern about, this medication cause a drop in potassium level, right? So what we call another word of potassium, another word of low potassium is what we call, that's we call hypokalemia, right? Answer B is your final answer. A client with heart failure is prescribed furosemide. Which assessment finding should the nurse prioritize monitoring? So when we are giving this medication, what we monitoring for? We are monitoring for serum potassium level, right? Right. A client with history of heart failure is due for a monitoring dose of furosemide. Which serum potassium level, if noted in the client laboratory report, should be reported before administering the dose of furosemide? So what's the normal potassium numbers? So 3.5 to 5.0, you must know that is your normal potassium lab value, right? So what's the low lab value here? So 3.2 is the low lab value, right? The potassium is 3.5 to 5.0. So that's the most concerning at this time. So nurse should report before administering. So answer A is your final answer. Which serum potassium level, if noted in the client lab report, should be reported? So low potassium should be reported to the MD. So 3.2 is your final answer. Lock it. A nurse is caring for a client with who is taking furosemide for heart failure, right? The client serum potassium level is 3.1. So SE potassium level is low at this time, right? Which of the following action should the nurse take? Again, when the potassium level is low, you are going to hold this medication and notify the physician, correct? So answer B is your final answer. A client with heart failure, because if the potassium is running low and you're giving this medication, that means it will cause more drop in potassium level. So you hold the medication, let the doctor know, right? Right. Next question. A client with heart failure is prescribed furosemide, right? The nurse should closely monitoring the client for which potential electrolyte imbalance. C, the answer is hypokalemia, right? But again, I just want to mention you, if you know this words hypokalemia, see all your question, they're gonna twist the question, right? They're gonna just twist the question, but answer is gonna be same. As far as you know that information, the one I just mentioned you, all you gonna get right answer immediately, because they're gonna just twist the question, but at the end the answer is gonna be same. Next question, which of the following action by the nurse is most important when caring for a client with renal disease who has ordered for furosemide? So as you must know, this medication excrete through kidneys, right? So what you have to do, you have to assess urine output and renal laboratory values for sign of nephrotoxicity, right? Because you want, if the kidneys they are already bad and then you are giving this medication, it will damage more. So that's why time to time, as I mentioned, you have to check for their creatinine to see if the kidneys are working properly and how much patient is losing the output. So assess urine output and renal laboratory values for sign of nephrotoxicity. Final answer. The nurse is providing teaching to a client who has prescribed furosemide, right? Which of the following should the nurse teach the client? What do you have to teach the client? Those who are taking. So when you read this question, you gonna tell the patient to rise slowly from laying or sitting position to standing, because this medication causes orthostatic hypotension. So you tell the patient to get up slowly in order to prevent fall, right? Hmm. The nurse plan to closely monitor for which clinical manifestation after administering furosemide. So again, we are giving this medication to lower the blood pressure, right? This medication is given to the patient with hypertension, so this medication will drop in blood pressure. So your answer is C. The nurse for a patient taking furosemide is reviewing the patient most recent lab values, which are sodium, potassium is 3.2, blood urine nitrogen. What is the nurse best action? So when the potassium is running low, you don't give this medication. Where is the answer? Hold the lasix and notify the physician. See, simple. They're gonna just twist the question, but answer is gonna be same. A female patient receiving furosemide lasix 40 milligram by mouth twice a day in the plan of care. The nurse should emphasize teaching the patient about importance of consuming. So you have to, when somebody taking this medication, they are losing too much potassium in the urine, right? So you have to tell the patient to have potassium rich food. So where is potassium rich food? Which one? Banana and orange. See, banana and orange will give you potassium. So tell the patient to eat banana and orange. A client with congestive heart failure is about to take lasix. Which of the following potassium level, if noted in the client record, should be reported before giving this medication? So what is the potassium level? Normal 3.5 to 5.0. So answer D. It's less than 3.5. So that is your answer. A, B, C, they are normal in range. The nurse would hold a dose of furosemide if the patient blood pressure is what? So this, as I mentioned, this medication causes drop in blood pressure, right? So as I mentioned in my where I'm in my I have seen it, like the doctor usually order a hold this medication if SB systolic blood pressure is less than 100, right? Because if the blood pressure is running low, less than 100, and you give this medication, it will drop more in blood pressure, correct? So that's why the nurse would hold the medication if the blood pressure is, answer C, less than 100, you're gonna hold it, right? So answer C, because if you give, it's gonna drop more, could be lethal. A patient with acute pulmonary edema is receiving lasix. What assessment finding indicate to the nurse that the intervene is working? So in this question, you have to think properly, rethink it, right? So this medication, what it's gonna do, is gonna remove excessive amount of fluid from your body, right? So how we gonna know this medication is working? This medication remove fluid from your body, right? So that's mean once the fluid is removing from your body, the lungs sound is gonna be clear. Otherwise the lung will have crackle, right? So once the lung sound is clear, that means this medication get working properly and removing good amount of fluid from your body. So answer C is your answer B. Answer C is your final answer. When providing discharge teaching for a patient who has been prescribed furosemide, it is most important for the nurse to include which dietary item to prevent adverse effect. So what food you gonna give it to the patient? As I mentioned, orange, spinach, potato, banana, dry nuts, those are your potassium rich food. So answer A immediately, that is your right answer. The nurse is providing discharge teaching to a patient furosemide. Which statement by the patient indicate a need for further teaching? So in this question, they are saying which answer is wrong here. So which answer is wrong? I will weight myself daily. Yeah, that's a good thing. I'll take this medication in the evening before bed. So no, that is the wrong answer here immediately. Why this medication is always mostly given in the morning time? If this patient gonna take this medication in the evening before beds, that's mean all night long is gonna go to PP. So that's the wrap of our all the question, around 16 to 17 question, and I hope you got all of your answer immediately correct, right? So I hope you like. I hope now you have good foundation on furosemide lasix. Good luck.